cardiology has been ahead of the urology community, and having data that preventive measures can be extremely powerful. For example, and I'd urge any of you that never watch it, there's a documentary called Forks Over Knives in 2011 that focuses predominantly on the ability of lifestyle to reverse heart disease, obesity, diabetes from a very strict scientific standpoint, from data from the Cleveland Clinic and Cornell, but it's made for patients, Forks Over Knives. So we've had but the data goes back 30, 35 years. It's extremely, this kind of ties in everything. How do you present it to people? It's extremely, we've found in the cardiology community that does this, extremely empowering to patients when active surveillance also means they've got a role. And their role is the question, have you been exercising? Have you kept that 5 pounds off you promised you do? Have you avoided processed red meats like bacon, hot dog, salami, pepperoni, which are associated with prostate cancer and progression, according to the World Health Organization about a year ago, in a fairly profound study on its impact on colorectal cancer, but prostate cancer was one of the other cancers that spike. If you're eating eggs and bacon every morning, your active surveillance might be as simple as changing oatmeal. Are you on a treadmill and are you walking? These are, because if you're not going to die of prostate cancer, I hate to break the news, you're going to die of something. And what I tell my patients, I'd rather you die of somebody else's problem. My promise to you is you're not going to die of my disease. So we're battling each other, but if as you work on the active surveillance lifestyle, stress management, obviously don't smoke, monitor alcohol. Dr. Lutz, you will be working on your total body health and certainly cardiovascular, the number one cause of death in America, at the same time. It's very interesting that the lifestyle program for prostate cancer is scientifically proven identical to the lifestyle program for preventing cardiovascular disease. So if you wear a seatbelt, wear a bike helmet, you're going to be around to your 130, I think, if you do this stuff. Dr. Lutz shared with me in the last 2 days, the headlines, New York Times and others, a study of 800,000 people were assayed as to how many nuts they eat a day. So you're an active surveillance patient. It turns out a handful of nuts, which is 2 dozen almonds, or about 12 pecan halves, if you want to write down notes, reduces your risk of cancer by 15%. It oddly reduces your risk of infectious disease by 75%. So you can throw in, without too much fear, I like walnuts because of the highest in omega-3, which for cardiovascular disease. But adding in a handful of nuts a day is active surveillance, and it works on multiple organs. I've trained in something called functional medicine. Well, the body's a network, and if it's good for the heart, it's good for the prostate, it's good for the brain, it's probably going to be good for your kidneys. And we're finding in these nutritional studies, it's absolutely the science. Tomatoes have multiple components, but they have an antioxidant called lycopene. So it turns out it's extremely potent and healthy for arteries, and it's proven to be extremely potent and healthy for prostate. Just another example. Eat your tomatoes. Don't eat too much ketchup, but tomatoes.